no later than 50, it is not uncommon to see perimenopause or even menopause in the early 50s.
We may have touched on this just briefly, but sort of what age should women start thinking about menopausal planning? I guess I would use an analogy of like, a retirement plan. You don't want to wait till you're retired to plan that out, so you don't want to wait until you're menopausal to plan that out either.
No later than 50, as early as 20. At 20, you would just be getting your baseline labs like any individual, regardless of male or female. But no later than 50, it is not uncommon to see perimenopause or even menopause in the early 50s. So I'd say that's the latest possible. That being said, it's likely that your progesterone or even androgens have already started to decline even at age 50.
Yeah, so I mean, if you happen to go through an earlier menopause, at 45, and you've planned, well, I'm going to talk to my doctor about this at 50, then you're kind of, you're in a zone that you don't want to be in. You want to be able to be proactive. So I think, 40 is certainly, if you have a hysterectomy, or if you're going to have hysterectomy and your ovaries taken out as well, you would want to have those conversations beforehand so that when you are surgically menopausal, you have a plan in place to address that and sustain your quality of life.
Any pathology that is related to hormones or hormone optimization or a suboptimal hormone profile, a conversation regarding your baseline hormones, whether it's in the ovulatory phase, luteal phase, or follicular phase, you should chat with a healthcare provider about that at that time. I would venture to say the far majority of women have either subfertility or PCOS or endometriosis or adenomyosis or menorrhagia, excess bleeding, or oligomenorrhea, less periods than you would expect, or heavier periods than you would expect, or even acne, or if you've been on an oral contraceptive, which I consider synthetic HRT, or if you have symptoms of poor sleep. Any of these symptoms, which again, the far majority of females do experience, then at that time, you can have a conversation about getting your baseline labs and where you feel best, because of course, in all these pathologies, the goal is to get back to normal as naturally as possible, completely naturally, if possible. And then you should get your baseline labs while you're feeling good and things are regulated. That way, when a rainy day does come, you have that data to utilize.
Yeah, I'm a big fan of that as well. People getting a baseline when you're young and healthy and feeling well. A lot of times people are getting away with sleeping less and eating more than they should, but you're still maintaining your health. And then you have an idea of where those numbers are, and then you can go back and compare those across time when you're getting the blood work.